Good afternoon. Thank you very much, everyone, for joining us today. My name is Ivana Zanardo. I'm the Vice President of Client Services at the Healthcare of Ontario Pension Plan. I'm pleased to welcome you to today's webinar on behalf of HOOPP and our co-host and research partner, Commonwealth. At HOOPP, we've been leading and participating in research projects related to retirement security for years. Last year, HOOPP and Commonwealth, in partnership with the National Institute on Aging, released a research paper entitled The Value of a Good Pension. It focused on the value that good pensions deliver for individuals. Next year, we look forward to releasing part 2 of this research, which focuses on the immense value that good pensions can provide for employers. Today's discussion will focus on the financial implications of COVID-19 for Canada's workforce and how employers can support their employees while also creating greater long-term business value for their organization. I'd like to begin by introducing my co-host, Alex Mazur, co-founder of Commonwealth. Alex is a founding partner at Commonwealth, a mission-driven business focused on expanding access to retirement security. Commonwealth partners with associations, unions, and other groups to build and manage large-scale collective retirement plans. The company's focus is on constituencies that are uncovered or underserved by traditional employer-sponsored retirement arrangements. Now I'd like to take a moment to introduce today's panelists, who we're very grateful to have with us today, who bring unique perspectives from the public, private, and nonprofit sectors. We have Liz Mulholland, CEO of Prosper Canada. Prosper Canada is a national charity dedicated to expanding economic opportunity for Canadians living in poverty through program and policy innovation. Liz and her team work with governments, businesses, and community groups to develop and promote financial policies, programs, and resources that transform lives and foster the prosperity of all Canadians. Eleanor Marshall, Vice President of Pension and Benefits and the Assistant Treasurer at Bell Canada. Bell Canada is one of Canada's oldest companies, founded in 1880, and represents over 50,000 employees across Canada. Eleanor brings a wealth of experience in pensions and investments as she sits on the board of directors with the ACPM and Vescor Investment Management Corporation. And Renée Légaré, I hope I said that right, Renée? Renée is the Executive Vice President and Chief Human Resource Officer for the Ottawa Hospital. The Ottawa Hospital is one of Canada's largest teaching hospitals and partners with the University of Ottawa Heart Institute, one of the country's most distinguished cardiovascular centers. Renée has worked at the Ottawa Hospital for the past 8 years, bringing to the organization over 25 years of extensive experience in human resources. At this point, I'd like to hand it over to Alex, who's going to walk us through a presentation.
Well, thank you very much, Ivana, and it's a pleasure to be here. I'm really grateful for everybody who's participating today to talk about this important topic, and heartened by the turnout as well, because there are many kind of pressing short-term issues, and this is one of those longer-term issues and shorter-term issues that we think is really important, and we're delighted to spend a bit of time having a conversation today. So as Ivana mentioned, we spend at Commonwealth most of our time providing retirement plans for those that lack access, but we also invest time on research projects on issues that we think are really important to improving the health of our retirement system here in Canada, and this is one of those issues. Our first report, as Ivana mentioned, was really about the value to individuals of being part of a good collective workplace retirement plan, and we started working on the second report about a year ago because we thought it was time for a different conversation about retirement benefits in Canada. A conversation that focused less on pensions and retirement arrangements as purely just a cost to employers, and focused more on these things really as an investment in the workforce, an investment in productivity, an investment in employee financial health. Obviously, we started this research pre-COVID, and we've been reflecting since the beginning of the pandemic about what does this mean? What does COVID mean for financial security of the Canadian workforce? And really today's webinar is about that conversation. So if you kind of step back and look at some of the key data, this is pre-COVID data. You know, we talk a lot in our industry about the retirement savings challenge, but there's really a broader financial security challenge facing Canadians. And I think of these statistics, probably the one that jumps out the most to me is the 43% of Canadians living paycheck to paycheck, really not having, or they don't feel they have the capacity to save. And that's a really big problem for our society, both shorter term and longer term. Some of these statistics about the number of Canadians, 10 million Canadians without a workplace retirement plan, don't bode very well in terms of making these things better, because we know that workplace savings arrangements can be extremely effective in encouraging financial security. And we also know that Canadians, even pre-pandemic, were struggling with things like emergency savings, or having enough for something like if their car breaks down, or if they have an unexpected change in their job. And we know these things are happening more frequently now with the pandemic. So, you know, how has COVID-19 impacted Canadians' financial lives? We know there has been an increase in financial stress. We know that people's finances have been affected. There's a recent poll that HOOPP conducted in partnership with Abacus that found that 57% of Canadians, and this is a more recent poll, have had a financial impact as a result of COVID. We have seen some, you might call them positive things in terms of savings. We know in the second quarter of 2020, the savings rate was at its highest level since 1961. But we also know that a lot of that probably has to do with people adjusting to the uncertainty that they know in terms of their future income. So what's going to happen in the future in terms of government benefits, in terms of the economy, in terms of people's jobs is uncertain. But I think it's fair to say that COVID-19 is unlikely to make things better. It's likely to make things worse. So we've talked for a long time in Canada about the productivity challenge that we have in this country. We know we lag behind the US in terms of the productivity of our workforce. For each hour worked in Canada, Canadian workers contribute about 30% less to GDP compared to the US. We know we also lag in terms of innovation compared to other countries. I think there was a study that came out from a Bloomberg index that showed us 21st in the world behind Slovenia. And why do I bring this up? Well, it's in part because there's a lot of data that shows a strong link between employee financial wellness and the productivity of workforces. And when you think about it, it makes sense. If you're worried about your finances, it's hard for you to bring your full self to work. You can easily get distracted. There's some really interesting data from the Canadian Payroll Association that shows that people, especially when they're living paycheck to paycheck, are subject to presenteeism, meaning that they get distracted by financial issues at work. We know it's more difficult for employers to attract and retain talent when they don't have high quality workplace retirement plans. And so, we think there's an opportunity for the provision of, workplace financial health and retirement benefits to be part of a strategy for Canada to increase the productivity of its workforce and also the innovation of its economy because of some of this mounting evidence about the link between these things. If you look at the Canadian retirement system, we have really three pillars that we talk about: government benefits, workplace retirement plans, and individual savings. And there's been a strong effort over the last decade to enhance what we call the first pillar, the government benefits. So we've seen the CPP enhanced, we've seen increases to the guaranteed income supplement, and that's been good progress. But there is more work that needs to be done, particularly on the workplace pillar. And we'll talk a bit more about that as we go. International studies have shown that that's really the greatest weakness in Canada's retirement system, that we're lagging some peer countries in terms of the coverage of workplace retirement plans and the adequacy of those savings. And it's also fair to say that as great as government benefits can be, the CPP enhancement, OAS, and guaranteed income supplement, it doesn't do that much to address the financial stress that Canadians are feeling today if they're pre-retirement. People don't understand those benefits very well. Those things are far off into the future. So if you tell someone you're going to get a CPP enhancement, it's going to be phased in over 40 years, it doesn't help that much if you're worried about the sustainability of the CPP, even though that may be a mistaken belief, and if you're worried about savings today. That's not a liquid asset that you can access. So the idea of enhancing Pillar 2 and Pillar 3 and helping with savings is a very important thing to build on those reforms to government benefits. And this paints the picture of why a lot of international surveys have found that Canada's weakest area is in Pillar 2 coverage. We have some of the world's best pension plans. For the public sector, HOOPP's a great example of that. The kind of Canada model of pension plan, been very, very successful, recognized around the world by the World Bank and others. But if you look at the private sector, the picture hasn't been so good. This is really showing the decline of workplace retirement plan coverage since the 70s, and the shift, which a lot of people are familiar with, from defined benefit arrangements to defined contribution, and some employers kind of not providing a plan at all. So part of our view on this, and we'll talk about this more, is this isn't necessarily because employers have decided workplace financial health isn't important. It's because there's a lot of challenges in our current system, which is really based around the single employer, to employers providing high quality retirement arrangements. And these are some things we need to work on. Now, for an employer to provide a retirement plan, it really only works if the employees value it. Because the employer is going to provide a benefit, they want to make sure that that's understood by the employer and by the employee. And HOOPP has been conducting some really interesting research over the last couple of years about how Canadians value workplace retirement plans. And the headline from this is really that they value them a lot. They understand the value of a good plan. They understand the value of guarantees in their income. And they are also willing to accept, in some cases, a lower salary in exchange for a better workplace retirement plan. So while they may not understand all the ins and outs of defined benefit versus defined contribution and different investment products, and they wouldn't know the word decumulation and a lot of industry speak, they understand at a basic level that this is something that has value for me that I probably wouldn't be able to access if I were trying to do it myself. So for those of you who haven't seen the first report that Ivana mentioned, this is just a brief, I've got a couple of slides to summarize kind of the key findings, because the question is, what defines a good plan? What makes a good plan? And part of our research isolated 5 main, what we call value drivers of a good retirement plan. And basically, what are these things? These are things that determine whether a plan provides good bang for the buck. In other words, we define value as how much retirement income you get for every dollar of savings, whether that's savings by the employee or contributions by the employer or a combination. So you're really looking for something that is very efficient at turning savings today into retirement income tomorrow. So there's 5 things that determine that. The first is savings, and this is really about saving regularly, saving in a disciplined way, saving an adequate amount, not taking breaks in your savings. And this really comes down to making it automatic, doing things through payroll deduction. It's a very effective way of doing it. There's one study that found that if you save through payroll deduction, employees are 15 times more likely to save than if they're trying to do it on their own. Fees and costs is basically self-explanatory. We have some very high fees in Canada. And if you can bring those fees lower, it has a really significant impact on people's retirement income, especially in an era of lower expected returns. Investment discipline is actually not about beating the market. It's about avoiding common mistakes that many individuals make if they're trying to invest on their own. Things like trying to time the market, coming out at the market at the wrong time, chasing performance, picking a fund that's performed really well recently, or just getting things like asset allocation wrong. These are common mistakes that a good plan can help you avoid. Fiduciary governance is something about really the value that you have a structure that puts members' interests first, something like a Canada model type plan, or a different arrangement where there's a fiduciary duty to members. You can add additional value, and Canada model plans have proven that over the last decade. And risk pooling is really about the post-retirement phase. How do you protect people against the risk of running out of money, one of people's biggest fears, and the risk of an ill-timed market event as you're entering retirement, which can have a devastating effect on your retirement income. So these are really the 5 value drivers. They actually cut across defined benefit and defined contribution. Commonwealth's a capital accumulation plan provider, HOOPP's a DB plan. You can have these drivers of value in different kinds of arrangements, but many of them lack at least a number of these drivers. So we applied these to different kinds of typical arrangements that Canadians use to save, all the way from a typical individual approach, and that might be using a mutual fund, saving through a large financial institution, trying to do it on your own, all the way through to, if you work for a smaller employer, you might have a group RSP. If you work for a larger employer, you might be part of a DC pension plan, or you might be part of a plan we call a large-scale pool plan, which includes a number of these drivers of value. all the way through to a Canada model pension plan, which is a plan like HOOPP or Ontario Teachers or other major DB plans. And what we find in this is that there are very significant differences, both in the bang for the buck. So in other words, the bang for the buck in a Canada model pension plan is more than 3 times more what you would expect with a typical individual's retirement savings. And also in the total lifetime contributions required to fund retirement. So this, for a typical individual, and this is somebody who's a little bit below middle class as a case example, it would cost over $1 million for that person and her employer to fund retirement using a typical individual approach. And it could cost as little as almost a quarter of that if you were saving in a Canada model pension plan, and significant differences as you move up that spectrum towards a more collective plan. So, you know, this is pretty significant in terms of potential savings for somebody or the potential value that can be generated in someone's financial life by providing access to that type of plan. And the way we think about it is, how do you move people up the spectrum? It's not going to be possible for everybody necessarily to have access to a called a best-in-class pension plan. But as you move incrementally up the spectrum and add more drivers of value, then you have more opportunities for a more affordable retirement and a more efficient retirement for the typical Canadian. Of course, these are archetypes. It's not to say there aren't individuals that can figure out on their own how to lower their fees, how to save regularly as soon as they start working, how to pool longevity risk. There may be a small number of people who can do that, but the typical person, when you look at the data, is not going to do that. And so the question is, how do you help them with a better quality arrangement? So if you actually break this down into the value drivers, it's interesting to look at how each one contributes. So it's probably not a big surprise that fees and costs contribute a lot. We've seen more and more investor education about this, more and more even ads about the impact of fees. So that's a significant savings you can get by lowering fees. But the interesting thing is that a lot of the other value drivers are also really considerable. So helping people avoid investment mistakes, that could be worth $100,000 over the lifetime for a typical Canadian. And even more importantly, the pooling of longevity and investment risk, something like what a defined benefit plan can do. And there's other instruments for doing this as well, including life annuities and other instruments that people are exploring. But how do you help people avoid the risk of outliving their money? How do you help them avoid a market crash when they're 64 and they're about to enter retirement? That's actually the most significant of these drivers of value in the research that we did. And again, it's not about necessarily capturing all of them. If you can help your employees with even just one of them, that is a lot of value that you can create for them and a lot of help you can provide. So that's a little bit of a recap of our last report. One thing we looked at, and we are looking at as part of this next report, is the whole issue of portability. So we know that work has changed. We know that a lot of employees don't spend their whole career with one employer. We know that changes are frequent. So this is a case example of an employee that's actually comparatively lucky if you're in the private sector. So this is an employee in the first case, in scenario A, that works for 4 different employers throughout their career. And at each employer, they actually have a pretty good capital accumulation plan. They work for larger employers. But in this situation, the employee changes employers and then takes their savings and rolls it into a retail offering or more of a typical individual approach. And this is a very common practice in the insurance industry. When somebody leaves a plan, they often will get rolled, if they stay with that provider, into a retail higher cost plan, which may still have some benefits, but is not as good as the company plan, and that can be expensive. Or they may leave the company and decide that they're going to invest on their own or invest with a major financial institution. In the second scenario, scenario B, we have somebody who stays in a plan with similar features throughout their career. So they're continuing to benefit from the lower fees, fiduciary protection, other features that come from being part of a larger collective retirement plan, and they're not rolling those savings as they change jobs back into a typical individual approach. And the bottom line from this is really more than $300,000 more in retirement income, or to even make it more accessible, 5 more years of retirement income. That's the difference between having a plan that's truly portable and having a plan that is not portable. So this is an issue we haven't talked a lot about in Canada. It's got more attention in the US, but it's something we really need to pay attention to as the workforce changes, because providing portability can create a lot of value for employees. We've got to think about this as the nature of work evolves. So to kind of bring it back to the reason we did this research, we really think there's an opportunity to think about retirement benefits as an investment, not a cost, not just a cost. We want to try and provide a framework around how it creates that value, how it can generate a better return on investment. Part of that story is about productivity, as we mentioned, and increasing the innovation, reducing the level of financial stress in the Canadian workforce through effective workplace-based financial interventions. We also think part of the story is a story of what we call compensation efficiency. So if you think about it, if a high-quality workplace retirement plan is worth potentially hundreds of thousands of dollars to an individual over a lifetime, and if it's worth that much more compared to what they would do on their own, then it is a very efficient form of compensation as an employer, something you can offer. It may be more efficient than salary. It may be more efficient than other forms of benefits if you do it the right way. And this is really important if the employees understand the value of what you're providing. And I'm sure colleagues on the panel can speak to this. That can sometimes be a challenge because people may not understand, what they've got. If they have a HOOPP pension, or if they have another really good quality retirement plan. But that's an ongoing education effort by plan providers and plan sponsors. But if you can communicate that, that can effectively be a very efficient form of compensation. There's big opportunities in small business and the not-for-profit sector, in freelance, to provide access to these kinds of benefits and to help the economy, help workers at the same time. And that's the conversation we hope to foster both through today's webinar and through the forthcoming research. With that, I will turn it back over to Ivana, and we'll really look forward to the panel and the discussion.
Thank you very much, Alex. Very informative presentation. And just to let everyone know that we will have some time at the end of the webinar to answer your questions. So whether you have questions for Alex on his presentation or the panelists, you can enter them into the chat box. So we'll start. Liz, I'm going to start with you. We've heard a lot about the value of providing retirement plans to Canadian workers. How do you think that Canadian workers perceive the value of these workplace retirement plans? And has that perception changed as a result of the current environment we're working in?
I think Canadian workers have always valued workplace retirement benefits, but fewer and fewer of them actually have access to them, as Alex has showed us. And in our sector, which is the nonprofit sector, we know that 47% of workers are freelance, contract, part-time, and as a result, 850,000 workers in our sector have access to no kind of retirement savings plan. And we're in a sector that typically pays lower than the other two sectors as well. So financial insecurity is a fact of life for many people in our sector. And COVID has obviously made this worse, not just in our sector, but for Canadians more generally. And we know from data that we've looked at that 28% of Canadian households who are financially impacted by COVID in August were drawing down on their TFSAs and RSPs just to make ends meet at the end of the month. So we had inadequate retirement savings to begin with, and now people have depleted them even further just to pay their monthly bills and put food on the table, pay the rent or the mortgage. So we're actually further behind due to COVID than we were prior to COVID overall. So I think workers want and need workplace savings plans more than ever before. And I think if it's possible to say there's a silver lining to a pandemic, and I'm still not sure there is, I think it's been a huge wake-up call in terms of public awareness around the financial vulnerability of Canadians generally and workers in some sectors, particularly low wage, or in our sector, the nonprofit sector particularly. And the fact that there's a growing sense that that's no longer really an acceptable situation and that something needs to be done. I think the good news is there's no reason we can't build better retirement savings plans through workplaces for Canadians. The know-how and the innovation is there. So it's really just a matter of getting cracking. Thank you.
Very good. Eleanor, how about from your perspective? How do you think Canadians' perception has changed as a result of the pandemic?
Well, I think some of the points Alex was making. At least workers at Bell Canada enjoy a large institutionally managed defined contribution pension plan, and I think in a normal course, when asked, they value it. Similar numbers, 80% strongly value the pension plan and its role in their overall compensation and benefits. But I think day to day, they don't think about it too much. when COVID hit, especially in the early weeks and months of the crisis, there were a couple of responses, driven by the hierarchy of needs, I like to call it. First, considering their own personal health and safety and migrating workers to work from home and socially distance. And then, job security, whether they were able to retain employment through the crisis. And then third, turning to look at their pension investments. And in some cases, although thankfully to a very small extent, that involved some panic on how their investments were performing. So having to address that through a lot of communication and education and getting people to stay the course with their long-term investment goals. I think, in reflecting post-pandemic, Alex and Liz pointing out the obvious need for emergency savings and utilizing vehicles like TFSAs for those to bridge between government benefits and job loss is an obvious need for many, and I think people are working on that. And hopefully a learning on the investment side with the way the markets behave to stay the course and to focus on those long-term investment objectives. And we try and help that in our plan design to take a lot of decision making and encourage people to go with default investment options, default contribution rates, sort of to take that risky individual investor behavior out of the picture.
Yeah, different challenges, that's for sure. Renée, from your point of view, do you think Canadian workers' perception and the importance of retirement savings has changed at all as a result of the pandemic?
Well, I think being in the healthcare sector, obviously, I would say the pandemic for us was not so much experience about, like for them losing their job or being afraid because they were essential workers. So I think our challenges was more for us how to keep their health, how to make sure that their wellness was well balanced. Having said that, I would say, being in Ottawa, being, a lot of our employees was, the loved one of significant others or a member of the family have experienced some, what I call financial challenges. And I think for our staff, I think that was, there's always a positive out of a bad crisis like COVID-19 pandemic that I think make them realize how lucky they were to have this type of, what I can say, the retirement benefits to be basically secure and reliable to them. Going back to your first question about, how is it perceived? What I can share with at the Ottawa Hospital, I can tell that I would say a good workplace retirement benefits. I see a big difference when my workforce is older. This seems to have a better understanding. It's like directly related. I don't have any scientific on this, but it's to generational differences. Like when you have experienced generations, I think they're more, they embrace that better. I think for them, they see the importance of it and they see the importance of having a defined benefits. Like a pension plan as we do have. When I have a younger folks, I think it's exactly what Alex said earlier. For them, the bottom line, it's really what matter in the every 2 weeks paycheck amount. That's really what's important. TOH, we are highly unionized, 91%. And I have to say the unions are a good contributor, a good advocacy to the type of benefits that we do have and we do offer. And they help us out to basically promote that to our younger workforce, to explain to them that, the chance that they might have to, to be part of an organization that offer that types of benefits.
Yeah, it's interesting. It's always challenging to communicate to the various different ages of our employees and members. because we know the importance of having that retirement security. And we know that as people get older, it's closer and they can feel a little bit more, and they understand it better and more keen, but it's still critically important for us to communicate to everybody, especially the younger ones, as you mentioned, who are more concerned with their day-to-day. Absolutely. Eleanor, some large businesses are offering very good workplace retirement plans. Why has it been important for Bell Canada to offer workplace retirement benefits?
Yeah, well, Bell Canada, obviously, Ivana, you pointed out our long history dating back to 1880, and our initial pension plan, our defined benefit, doesn't go back quite that far, but I think it's 100 years old, and we still have active employees in that defined benefit plan, and many thousands of retirees across the country. Our new model is defined contribution, and we aim to make that as good a retirement savings model as we possibly can, given our size and our governance structure. And it's important to us because, well, first it's got an important role in a competitive compensation and benefits package that's so important for attraction and retention. I mean, employees across all generations, whether they focus on retirement savings when they're young or not, eventually will appreciate having it, and at some point, whether retirement is a concept foreign to them or not, they're going to want to draw on those savings for an income at some point later in their lives. And we really link it, as Alex was pointing out, to those human capital drivers. And if I could draw a parallel to the research that you're doing, with some research we did with Deloitte last year on the return on investment of mental health investments in the workplace. And that report came out last year. Is titled or subtitled "Good for People, Good for Business," which is, and it's really linking. I think we're all learning more and more the linkage between financial wellness and mental wellness in the workplace. So, building those retirement savings as simply as and efficiently as we possibly can to alleviate that burden and that financial stress on employees later in their lives, and giving them that other pillar to fall back on in their retirement is just as linked to engagement and mental wellness in the workplace as our mental health investments.
Yeah, I think even more so, given the environment that we're in today, there's definitely a linkage there. Yeah. Thank you. Liz, you've heard from the other panelists on their perspective. How would you say we make offering retirement security just as possible for those in the nonprofit sector?
Good question. It's a little more challenging because typically nonprofits don't have the deep pockets that large companies do, or governments. And also our revenues are typically as insecure as those of our workers. They fluctuate a lot. There's not a lot of stability. Often margins are very thin. And, the priority has always been on advancing the mission, sometimes at the expense of our own workers, sadly. So I think we need more plans that are tailored specifically to not-for-profit organization-specific needs. And one of those needs is that they're not all going to be in a position to offer matching contributions for their employees, or not in a position to offer them consistently depending on their financial situation. So we need plans that are flexible in that respect, that also offer opportunities for people who aren't a full-time permanent employee to participate, that are low cost, obviously, portable, administratively light. We're talking about many small organizations that don't have large HR departments. They have a tiny portion of one person in many cases who does HR. And also I think it'll be important to build in, and we've heard a lot about the importance of workers themselves understanding the value of retirement savings in these plans. So we need things like general financial literacy tools and resources for workers built into these, and help with planning for that transition to retirement. Because we know, particularly for low and moderate income people, of which there are many in our sector, that the wrong decision around when to take your CPP or your old age security, or how to transfer your savings into a form of income during your retirement can dramatically reduce your income flow during your retirement. So they need help on those. And also to Alex's earlier point, they need plans that are committed to serving the best interests of their members. And I think given the scale of Canada's retirement savings gap, and also, the growing acknowledgement that we have a growing wealth inequality problem, which is actually worse than our income inequality problem in Canada, governments themselves should be taking a really active interest in creating more portable retirement savings plans for folks in every sector that have been left out right now, and that's almost half of the workforce. And in particular, I think they need to put some seed capital on the table. These are ventures. It takes time to enroll enough members before you have the revenue coming in to make them sustainable. And like any small business, even if they're not for-profit plans, there's going to need to be some seed capital in here. And governments are really well placed to do that. And I think given that there's huge public benefit in getting the 43% of Canadians who aren't saving to save, and that reduces public expenditures down the road, that government should be racing to put money into these innovations and calling for them. Frankly, as somebody who spent 30 plus years in the policy world, I find it baffling that governments are blind to this issue and have not mobilized around this. And I hate to say this because we have very smart people in finance departments across the country, but there is a huge amount of financial illiteracy in our political class and in our policy class. It emphasizes income, 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 and does not look adequately at saving, and assets and the distribution of those in our society. So I think COVID-19 has been a wake-up call, and let's hope we can turn this crisis into a real opportunity to improve the situation. Thank you.
Good. Very good points. Thank you. Would you have any specific advice, because there are other nonprofit organizations who've joined us today, any specific advice for a nonprofit who's considering offering a retirement savings plan or want to improve the plan that they're currently providing to their employees?
Mm-hmm. Yeah, if they did nothing else, just set up your payroll so that you can, you're offering all of your employees as you onboard them, or your existing employees, a way to hive off and automatically deduct a portion of their paycheck and drop it into a TFSA, an RSP, a savings account, whatever suits them. If you have low and moderate wage employees, emphasize and provide information to them on the importance of tax filing and the income benefits that are available to them, as well as savings incentives for things like their child's education. If they have a child with a disability, you should be asking people when you onboard them, do you have school-age children or young children? Do you have a child with a disability? If so, this is important information that can make a real difference to the future of your child. Give them the information, connect them to help. And I think really taking advantage of those behavioral insights to make everything, as much as possible, things are opt-out rather than opt-in, would be really helpful. And if you have the wherewithal and you're set up to do it, offer free tax clinics at tax time and help your employees file their taxes. That alone will boost people's incomes very quickly. But in terms of good quality retirement savings plans and all those characteristics that Alex pointed to, those aren't things that you can create on your own as a small nonprofit. We really need to collectively get together, and the work that Commonwealth has done to put together the Common Good Initiative, which is an effective plan that's in the works, is a great first start on that, but we need more of those plans. So sectors should be getting together, saying, how can we create a plan for our employees?
Thank you. Renée, Alex in his presentation touched on portability, and a lot of plans offer portability as part of their offering. Can you comment on how the portability of retirement savings plans can help employees in their retirement, and how is it good specifically in the healthcare industry?
Okay. Well, I would say it's a major benefit. I think, like for the healthcare workers, they can move from one employer to another and not losing the investment, like for the retirement benefits. I would say definitely, like especially in the healthcare sectors, mainly the clinical one, they usually stay in the healthcare industry for the entire career. So they allow them to move in the same province from one employer to another. And that's what I've said. And for me, it's allowed us to not compete necessarily on total compensation necessarily, but compete on something else of what, like experience that they might have as an employee working from a hospital versus other healthcare organizations. I would say it's maybe less attractive for the non-clinical people, like people in HR, ISIT, finance, quality, and so on. Like I would say that if there's something, the HOOPP pension plan is so successful and so healthy and so great benefits for people, to a certain extent, I would say some of the people would stay, with us for that reasons. It will probably do less, less movement. One thing that I wish and what I see from Alex's presentation, definitely portability. It's something that government and regulators should look. And like I spent my career in the federal government before moving to TOH. And that was my biggest deception when I came here. I couldn't transfer, my pension plan to, from the federal to the provincial government, which was a major decision for me to jump. And that's something I wonder, as being public entities, I think there's probably should be something that it should be some portability or some agreement between different level of governments to facilitate, people to enjoy their job and not being worried so much about, my future investment, but more where could I contribute according to my skills and my experience. So I would say this is highly, I'm a pro on this. Not only that I see it from the healthcare sector in the province of Ontario, it's definitely a huge asset.
Thank you. Very good segue, I think, even from Liz's comments earlier and yours. I'll ask Eleanor, do you think policymakers and regulators are doing enough to help employers in offering good workplace benefits? And is there more? Clearly, I think we've heard a little bit that there could be more. Is there more that they can do?
Sure. I mean, the basic frameworks are there for a company like ours with scale. But even with 50,000 employees, addressing those obstacles that Alex pointed out between individual savings structure and the Canadian model, there's limits to how far a private sector single employer, even like Bell Canada, can get to. So we can have those auto features that address member inertia on enrollment and contribution. We can have the institutional level investment and governance structure. We can achieve, extremely low fees with our scale and size. The portability is, once they leave our ecosystem, they're out in retail unless they can port it to another pension plan. So, and that's just, as was pointed out, losing capital all along the way with the fees and the churn. I mean, to address that, we do have variable benefits, and we took advantage of that and now allow people retiring from Bell to keep their money in the pension plan and draw a variable benefit out of the plan. But at that, we need regulatory change and some innovation in the industry on the risk pooling. So pooling for longevity, we're not able to do that even in our size plan. So we need options that address that for the advanced life deferred annuity in particular, which there has been legislation, but no products available at this point. So there's always something, and I think that's a good structure that we're looking at, is those five obstacles to achieving, that model pension plan. That is where government and industry can focus their efforts.
Thank you. Liz, from your perspective, what can they do more of, legislators and regulators, to help employers? We can
Well,
offer
it might
good
not be
workplace.
seen as helping, but I'm always struck by Quebec when they implemented legislation that said that every resident of Quebec must participate in a pharmacare program. And either it's the government's program or it can be a workplace program, but they have to be enrolled somewhere. And that stimulated the provision of pharmacare one way or another. And I'm wondering if the time hasn't come to recognize that retirement savings is as integral to people's health, well-being, and future kind of prosperity and to the public good more generally. If you think about half of Canadians with no retirement savings as they approach retirement age, what that will do to the public purse and to our society, I think there's an interest in saying maybe we should be making this a part of general employment standards federally and provincially. And they regulate different sectors, but at the same time investing in the creation of those good quality plans that are designed for worker and public benefit, not just purely profit taking. And I think, as I said, putting some seed capital into that for plans that meet certain public benefit criteria, so that would be nonprofit, portable, affordable, flexible, and have a fiduciary duty to their members. At the same time, I think on the other side of the equation, government should be looking at how they the tax expenditures that subsidize the savings of Canadians, and understanding that they're putting a huge amount of resources into subsidizing middle and upper income Canadians to save, and almost nothing into subsidizing low and moderate income people to save. And that Commonwealth has a fantastic Canada Savers Credit Policy proposal to for the federal government to actually put in place a match savings program for low and moderate income people who put money in a TFSA, an excellent vehicle for them to save in. So that would be a great way to jumpstart people even before the workplace plans are available, to say, here's a way that we can help you start to build savings in a way that's flexible, can address your emergency saving needs, but also where you can put money aside for the long term in a vehicle that will not, when you go to retire, result in clawback of income benefits that you're eligible for. So those would be my prescriptions. Thank you.
Thank you. Renee, you touched a little bit on the portability and some changes you would like to see, and given your perspective of coming from the federal government as well. Do you think policymakers and regulators can do more to help employers?
I think they could. I really like what Alex said. You know, like it used to be a time pension plan was seen from an employer point of view, a cost. And I like what you said, Alex, at the beginning, like it should be seen as an investment. And I think communication, promoting, helping, and I like what Liz has said too, making sure that it's mandatory for every employers, because this is the future of the next generations. And we have to prepare that. We cannot just close our eyes and not, you know, like being responsible and accountable. The same thing I would say for every employees, they should be mandatory in participating. What I've seen, and I think it's going to be even worse and with the COVID now, post-COVID, is the, you know, like the employees now they're going to work for many employers. So that's seeing that their employment status may not be permanent. They may be temporary. They may be working for different employers and all of that. And I think the government and regulators should force, and I can't believe I'm saying that, but I think they should force employers to treat our temporary part-time employees and all that to start to invest in their future right off the bat. And as an employer, we should be almost accountable, you know, like to make sure that those employees have the best benefits, including their, you know, retirement benefits, investing for the future, that, you know, and not so much, because what we see with the gig economy now, not only that those employees are not protected at all, but I'm not sure what's going to happen when you're young and you're flexible, healthy, and all that. It's okay to jump on a bike and be, you know, like on time and, you know, on social media and say, yes, I can do it. But the day that something really bad would happen, an incident or whatsoever, or, you know, like for whatever reasons, I think the government and regulators should force us to be, you know, to support better our temporary workers, and forcing employers to be accountable for that type of responsibility and accountability. It's almost a social accountability that we should be being more sensitized about this. So that would be my 2 cents.
Yeah, there's clearly a responsibility on employers in offering workplace retirement benefits. I know that we feel as a provider, there's a big responsibility on us to ensure that we're educating members. We want to make sure that the members that are in our plan have the benefit and they understand the value of it, so that when they leave, they understand the implications of taking the money out, and we hope that they leave it in. And portability is very important to us. So we talked a little bit about what regulators and legislators can do to help employers more. Is there more that those in the retirement industry can do more? You're looking for more innovation from those industry partners, and if so, what type of innovation? We just have, I'm going to try and wrap up quickly so that we can go to Q&A. So I'll do a once round, and Liz, I'll start with you.
I think one of the most important things is to build in this concept of emergency savings beside retirement savings. And there are various models for doing sidecar emergency savings accounts, with the understanding that emergency savings, you don't put money in and leave it there for 50 years. These are accounts that you spend down and replenish periodically as life happens and the need arises. So finding elegant and simple ways to help people do that, setting in a target amount, and your automatic deductions would flow into your emergency savings account until you reach that threshold. Anything after that goes into your retirement savings, and if you spend down your emergency savings, the money goes back in there. But I think there are ways to do that, because we know from research in the United States that not having access to a liquid account is one of the biggest barriers to people who have more modest incomes or a lot of volatility in their month-to-month income to actually saving for the long term. So if it's going to take them 3 days to get the money out, or there's a penalty, they're not going to save in that vehicle. So you need to give them a good liquid vehicle alongside it. Thank you.
Thank you. I'm just mindful of time. Eleanor, any last comments on that point?
Sure, maybe just building on that, another way that could address some short-term financial needs and diversity of those financial needs in the workplace would be incentivizing debt repayment. So a model where, the employer contributes now to a retirement plan for matching what the employee contributes, but would they also match debt reduction for student loans and things like that to address debt reduction and help those short-term financial needs?
Thank you. Renee, we'll wrap up with you before we go to questions. Anything you'd like to add on what you think the retirement industry can do more of?
I think it's getting access to our people, the community, to financial advisors. And as an employer, what I discovered that my employee family assistance program is my best friend now, because it's a program that we paid, and often was more for mental health, for more difficulty, conflict at the workplace, but now it's for financial advice. And we're using that, and we're sending our employees, and I have to say, employees coming back and they're really happy with this. So it's helping them out, not only to be, understanding the importance of saving on the short term, medium, and also what you should be doing, not only relying on your existing pension plan, but what we presented is government, individual, and employers. So that's really the employee family and assistance program. That's a new key that I think we should explore more.
Thank you very much. Alex, I'll turn it over to you to see if we have any questions from anybody who's attended.
So there is a question for Renee. Renee, you spoke earlier about how it's common for older employees to appreciate the value of their pension plan more. And I think the question is that just about employees getting older and getting closer to retirement and therefore they appreciate it more? Or is it about, do you see a generational shift happening between older generations and younger generations and how they think about these issues?
It's an excellent question. I would say it's probably a mix of both. I would say the economic crisis of 2009 have changed a lot of things. And I think now with COVID, I would say that for a certain generation, they really see they really see the difference of having a really good pension or retirement plan, like a defined benefit, defined contribution, that it's well set up by an organization and employer. And I would say some of my closer to retirement employees are more appreciative of that. My younger generation, I have to say, it's really interesting because it's really, if they're not really stable in their life as a new adults, they just been graduated, and for them it's more like what's come to the paycheck and all this. But as soon as I would say they got settled, they bought a house, they have a mortgage, they settle with a family, that's where I think they're more appreciative of the entire, like the I would say the total compensation and the benefits package. And this is more and more, I would say, after 2008 and 9, we had a great opportunity, and especially being in Ottawa, define benefits pension plan. It's almost an entitlement in the city because there's so much with the federal government. But I think as much as in the past, that was something check mark and, like, don't compete on this because we were not able. Now it's more like, wow. And it's also, it's not a deficit. They're going to look, they're going to ask questions. How's your pension plan? How healthy is your pension plan? We're going to have discussion around that. And those discussions now, I would say it's not so much by generation, it's from everybody that are serious and they say, you know what, I think if I come here, I want to stay here for longer term. And now what I see, it's a bit, it's not so much which age, I have to be careful, but it's more about how much settled they are in their life and how much the things that, what do you have on the table? What do you offer me? So yes, there's a generational differences, but there's also, I would say, more and more in the city, people realize how much we are lucky because most of the employers offer such a benefit.
Just as we wait for more questions, one question that I had, because is any advice you might offer to others, whether it's employers or people that are making the case for either workplace retirement benefits or other investments in employee financial health, any advice about what to do or not to do in making that business case? Eleanor, I don't know if you want to weigh in on that or would welcome comments from other panelists.
Well, I think, if you're starting from zero, some of the challenges Liz has pointed out in sectors that don't typically have retirement savings plans offered. And I think you have to start somewhere, you have to start small. So, you've got to take some of those dollars that might be otherwise allocated to immediate pay and benefits and dedicate them to retirement savings. Best way to start is to search out a provider, a large provider with a platform that gives your employees access to those institutional quality savings programs, and start with 1% contributions and grow it from there. Try to get it up around the 10+% that you're going to require to supplement your CPP savings in retirement.
Liz, Renee, anything you'd like to add?
I think one thing that I think I don't do good enough is explaining how much the pension plan that we are offering at TOH, it's a good asset. What you've shown about, for every $1 that an employee, invests, there's more than $1, like for their future saving. And this is not something that I find that we're not promoting enough. And there's, there's one thing that I was listening to everyone and I was saying to myself, well, I have to go because right now I'm making, we're competing all for the same, clinical professional people right now. And even with the hospitals, often we have the similar benefits and all of this, but I have to promote this better to try to figure it out how I can differentiate myself from other places and how I can basically promote how much my pension plan is healthy as well too. And this is something for the last 8 years, we didn't have any increment of employees, contribution to those pension plans. So definitely this is something we should be doing. Any employers now that offering any retirement benefit should basically brag about this, promote this, and be more upfront about this. And I think we are shy because at one point that was not, we weren't sure that was still healthy and that was still, that we will keep it, because in my former employers, we had to change from defined benefits to defined contribution. And that's something you don't want to promote too far, because you don't know if your board of governors or, your board of directors will support that. This is really, it's a big decisions for employers and their shareholders. And that's where I think if we can change from the cost to an investment, and I think you're right, from the productivity or from the wellness of our staff, to make sure that now, if you remove that worries in them, that will be one thing less for them to be productive and focus and avoid presentism. And I think that's where we don't do enough, as far as I'm concerned.
Well, Ivana, I'll turn it back to you because I think we're at time.
Yes, we are. Thank you very much. Thank you very much. I thought that was a great discussion. I think, given your perspectives of the industries, I think we could have spent an hour with each of you individually. So thank you. Thank you very much to each of the panelists, Elizabeth, Eleanor, and Renee, for your valuable time. I know time is quite even more valuable these days. Thank you so much. Also, a very big thank you to Alex Mazur and our partners at Commonwealth. HOOPP, along with Commonwealth, have been working on this research paper that you've heard us mention a couple times. It will be released next year, so please look out for that in the future. Thank you very much again for joining us, and enjoy the rest of the day.
Thanks very much, Ivana.
Thank you.
Thank you.